let's begin with coordinated intake. We'll select new client. In this case, the client has given consent, and we will get a photograph and signature later on. The last name is Wilson. The first name is Jack. We'll put the phone number in as 404-123-1234, and we'll leave all these blank for this video. Let's just go to the HMIS and see that the information has been pre-populated, and we'll just enter the date of birth as so. And I think that's all we really need to do for now. Let's go back to the main screen and we'll pick assessment. So now we see Jack Wilson is in our HMIS information system, so much of that data will pre-populate the assessment so we don't have to enter data twice. The unique client identifier was established when we created the new contact record, and the database, this information may come from different sources. In this case, the data has been stored in the OpenHMIS system, and the name again has been pre-populated. Now we'll be beginning with our data pre-populated from the client profile. We'll begin to enter data into our VI-SPDAT assessment. Smith. John@email.com. Emergency shelter. Atlanta, New Shelter, Let's continue with the next session of the VI-SPDAT. B. History of housing and homelessness. We'll ask a few questions about the housing history. Are you presently homeless? Yes. How many months have you lived on the streets or in the shelters? 6. In the past 3 years, how many separate times have you been homeless and then homeless or housed again? 4. Where did you live prior to becoming homeless? In jail. Are you presently homeless? Yes. This section covers socialization and daily functioning. Is there anybody that thinks you owe them money? Yes. Do you have any money coming in on a regular basis, like a job or government benefit, or even working under the table, binning or bottle collecting, sex work, odd jobs, day labor, or anything like that? Yes. Do you have enough money to cover all your expenses each month? No. Do you have planned activities each day other than just surviving that bring you happiness and fulfillment? No. Do you have any friends, family, or other people in your life out of convenience or necessity, but that you do not like their company? Yes. Do any of the family or other people in your life ever take your money, constantly borrow cigarettes, use your drugs, drink your alcohol, or get you into things that you don't really want to do? Yes. Observation only. Do you detect signs of poor hygiene or daily living skills? Yes. We now continue with wellness, part 1. Okay, now I'd like to ask you a few questions about your health. Where do you usually go for health care, or when you're not feeling well? Clinic. What's the name of the place? The clinic. What kind of health insurance do you have, if any? None. Do you have now, have you ever had, or has a healthcare provider ever told you that you have any of the following medical conditions? No. No. Kidney disease? Yes. Several cases of frostbite? No. Liver disease? Yes. AIDS? Refused. History of heart stroke, heat exhaustion? Yes. Heart disease, arrhythmia, or irregular heartbeat? Yes. Emphysema? No. Diabetes? Yes. Asthma? No. Cancer? No. Hepatitis C, yes. Tuberculosis, yes. Surveyor, do you observe signs or symptoms or serious physical health conditions? Yes. Do you have a permanent physical disability that limits your mobility? Yes. We'll continue. Wellness Part 2. Have you ever had problematic drug or alcohol use or told you do? Yes. Consumed alcohol every day for the past month? Yes. Ever used injection drugs or shots in the last 6 months? Yes. Ever been treated for drug or alcohol problems and returned to drinking or using drugs? Yes. Used non-beverage alcohol like cough syrup, mouthwash, rubbing alcohol, cooking wine, or anything like that in the past 6 months? Yes. Blacked out because of your alcohol or drug use in the past month? Yes. Observation only. Surveyor, do you observe signs of symptoms of problematic alcohol or drug abuse? Yes. Have you ever been taken to a hospital against your will for a mental health reason? Yes. Have you gone to the emergency room because you weren't healing 100% well emotionally or because of your nerves? Yes. Have you spoken with a psychiatrist, psychologist, or other mental health professional in the last 6 months because of your mental health, whether that has voluntarily or because someone insisted that you do? Yes. Have you had a serious brain injury or head trauma? Yes. Have you ever been told you have a learning disability or developmental disability? Yes. Do you have any problems concentrating and or remembering things? Yes. Observation only. Do you detect a sign or symptoms of severe persistent mental illness or severely compromised cognitive functioning? Yes. Are you currently or have you ever received treatment for mental health issues? Yes. Have you had any medication prescribed to you by a doctor that you do not take, had stolen, misplaced, or where the prescription was never filled? Yes. Have you experienced any emotional, physical, psychological, sexual, or other types of abuse or trauma in your life which you have sought help or which has caused your homelessness? Yes. We'll continue. Demographic information. I'd like to ask you a handful of questions now that can help us better understand homelessness and improve housing and support services. What is your race or ethnicity? Asian. What is the highest grade in school you've completed? Some high school. What is your gender? Male. Do you have any children under 18 who are living with you? No. Have you ever been in foster care? No. Have you been in jail or prison in the last 6 months? Yes. Have you ever served in the U.S. military? Yes. We continue. Contact information. This final group of questions is important so that we can contact you about housing resources when they come up. Is there a phone number and or email where someone can get in touch with you or leave you a message? Do you work with a case manager or outreach worker that you trust more than others? No. If yes, what is his or her name? What agents do they work for? On a regular day, where is it easiest to get you? In the park. What time of day would could we find you there? Afternoon. To finish, may I take your picture so that we can better find you if housing turns up? Yes. Any final notes that you'd like to convey? Needs permanent housing. We continue. Please click the Submit button to submit this assessment and place your client into the Unified Housing List. After you submit this form online, please also keep the following: 1. The consent form, and 2. The picture if taken. Now you can submit. This is Jack Wilson's score of 16 based on the way he answered the questions and your observations. Thank you for participating in VI-SPDAT.